Next on my list are bronchitis and pneumonia. Now, these are lower respiratory tract infections. These are caused by bacteria, viruses, and on rare occasions, fungi. The symptoms you might experience are cough with or without mucus, chest pain, difficulty breathing, fever, chills, or even weakness. How does this spread? This usually spreads through droplets from an infected person, and you can easily contact this if your immunity is low. So you see, it's important that your immune system is always boosted to keep these infections at bay. How do you treat bronchitis and pneumonia? Depending on the cause, if it's caused by virus, you do not require an antibiotics. You basically need rest and then fluid. But if it's caused by bacteria, then you're going to require an antibiotic. However, if your cough lasts over 3 weeks and is accompanied by chest pain and high fever, it's important that you seek medical help ASAP. Let's take a quick recap on what we've said. Common cold is caused by a virus. Key symptoms are sneezing and coughing. Does it require an antibiotics? No. Urinary tract infection is caused by a bacteria. Key symptoms include burning, urinary urgency, and pain in the pelvis. Does it require an antibiotics? Yes. Gastroenteritis is caused by either a bacteria or a virus. Key symptoms include vomiting and diarrhea. Does it require an antibiotics? Yes, if caused by a bacteria. Skin infection, usually caused by bacteria, fungi, and viruses. Key symptoms include redness, pain, blisters, rashes, depending on the cause. Treatment, does it require an antibiotics? Depending if it's caused by bacteria. Pneumonia is caused by bacteria and viruses. Key symptoms include cough and chest pain. Does it require an antibiotics? Yes, if it's caused by a bacteria. Infections are common, but knowing how to recognize and respond to them is powerful. Don't self-medicate. Don't panic. With the right information, you would know when to wait and when to see a doctor. Was this helpful? Drop a comment with an infection you've experienced and how you were able to recover. Don't forget to like, share, and subscribe for more health wisdom made simple. In episode 5, we'll dive into a hot topic. When do you actually need an antibiotic? Until then, bye.